welcome to Inside of New England's Therapeutic Talk. Please like, subscribe, and comment below. Hi, today I'm going to be joined by two beautiful women who have been doing a lot of amazing work over the years and are currently working on some really wonderful things right now in our community. And I hope that everybody will be able to learn something and get some really good takeaways and ways that you can actually try to help out as well. And I hope that everybody enjoys. Hi, I'm Candace, and you're watching Inside of New England's Therapeutic Talk. Today we have a couple of special women in the community. They're going to talk about some of the work that they're doing. Would you guys like to introduce yourselves?
I'm Michelle Stewart-Copes with SEEK Consultants, System for Education Equity and Transition. And Marie and I have been working now for the past 5 years in developing health equity initiatives with 40 organizations here in Connecticut. We're contracting with the Department of Children and Families and other organizations, and we're really excited about equity during these challenging times, looking at health equity, behavioral health equity, and we do implicit bias training to make sure that people are really aware of the obstacles that are standing in the way of true equity and racial discrimination.
So my name is Dr. Marie Spivey, and I'm a principal working with Michelle at SEEK Consultants. And we've been doing quite a bit, particularly in New Britain, with the clergy, as well as now with the chamber and the hospitals, and quite a few different organizations, emergency medical services, etc. But we do work throughout the state with, as Michelle mentioned, with community-based organizations, particularly around with behavioral health, and with students, with youth, and with adults as well. So we can tell you a little bit more, and Candace, if you want to ask us questions, that would be great.
Okay. Is there anything that we can do to help the work that you're doing?
One thing that we were really excited about, the New Britain EMS developed a Faith-Based Citizens Academy, and they had give training to faith-based leaders, ministers, and congregants, and it was all around what do you do until help comes. They did family and friends CPR and stop the bleed. And now we're looking at developing a micro behavioral health clinic, which would be a partnership of informal supports throughout the community, plus providers, to really look at how can we better serve the disenfranchised community. So providers that really have that specialized interests, skills, and resources and staff would be wonderful to be able to make referrals, to be able to develop support, and also to coordinate care around that effort.
Yeah, we've for quite some time now, we've been working with organizations around the national class standards, or the enhanced class standards, cultural and linguistically appropriate services. And that was started way back when, in the year 2000, with out of the Office of Minority Health, the Department of Health and Human Services Office of Minority Health. And when those standards were created, it was thought from around the country that there were disparities that existed with between people of color and Caucasians. That was a study that came out of the Heckler Report, and that's when it all began. But in 2013, these class standards were enhanced, and we actually had, I was working with the Connecticut Hospital Association at the time, and we had Dr. Nadine Grazia come from the Office of Minority Health, and she was the director at that time. And she came and really launched the enhanced standards. And there was at that time a principal standard that really covered the remainder of the 14 standards. So we have been working with all of the organizations around class standards and helping them to identify what the disparities were in the communities they serve, as well as what they need to do about conducting those services in a better manner. I think most of them have had issues around language barriers. And that brings me to what we're doing right now with Dr. Fatwati Abu, and we're working with her in the police departments in New Britain, as well as the fire departments and others. So there's quite a bit that's going on in New Britain, and I think it's absolutely wonderful that these organizations that are serving the people, all of the people in New Britain, I think it's wonderful that they want to know how to do it better. So that's that we connect the dots. Michelle and I connect the dots pretty much, and really do the education and training that's asked for and needed.
That is our motto, because you know how many people are stuck with doing their work in silos, and you waste so much money in duplicating services. So we really look to service coordination and really try to embellish that as much as we can. We were really surprised at how many organizations do not know about the class standards, and they are in danger of losing their federal dollars if they don't adhere. And it's so important right now today, because with COVID-19, we see the healthcare disparities, because people of color are 3 times more likely to get the virus and 2 times more likely to die. And we're seeing that here in New Britain because it's a hotspot. So people have to wake up and really look at how they can tailor their services to be more culturally and linguistically competent. And implicit bias stands in the way.
Right. And most of the organizations really need to know more about the COVID these days, and because everybody is affected. I've been doing contact tracing with the Central Connecticut Health Department, and it amazes me. Well, it shouldn't amaze me, but it does. What people know about the COVID, but they don't know what to do for themselves or for their exposure to other people. And it's really so extremely important for folks to really look for that information, ask for that information. There's a process that people go through when they've been diagnosed with the COVID, that they have to self-isolate for at least 10 days, and then don't run right out and get the test, because you're still shedding, but you're not contagious after that time. But anybody that's living with you also has to be tested, but at the end of the period of time when the person who is in the home has had the virus, at the end of that period of isolation, anyone living with them that has tested negative or who just come in, they really have to quarantine for another 14 days. So there's a lot of information that's available to them, to all of us, and it keeps changing. It keeps changing on a regular basis from CDC and CMS and our own State Department of Public Health. There's really a lot of information that we need to know in order to bring this so-called surge down, because it really isn't a surge of the virus. The virus has never gone away. It really is, the surge is caused by people who are becoming more relaxed, and really, developing clusters of people who want to get together because we're all tired of it. But being tired is one thing, but staying alive is something else. So we really have to, really be serious about this illness and do what we need to do. Wear our masks, stay our physical distancing apart for at least 6 to 10 feet, and washing your hands often, and just being wise and logical in taking care of yourself and others. Because once you wear your mask and others are wearing their mask, then that's a double protection. Both of you are protected. So that's what we really talk a lot about these days, and need to even more so.
Mm-hmm. Yeah, and with the implicit bias trainings, like, where are you guys doing those right now?
Been training all of the city employees here in New Britain. We've been
Yeah.
working with New Britain Police Department and the Fire Department and other organizations. We've also been doing some town hall meetings, just talking about Black Lives Matter and people being able to really be able to talk about their reactions, their physical reactions, as well as emotional, traumatic reactions to what's happening in this world right now. We're all suffering from vicarious trauma, and it's so important to really deal with that bias, to deal with our health concerns around these bias and systemic racism, and to come together to look at some healing strategies. Our partnerships are really very exciting in this work. Marie had talked about our work with Dr. Fawati Abu, and we've been learning a lot. One of the trainings that we are working with her on is the overview of the Arab and Muslim community in Greater New Britain, and we had no idea that we had over 500 families, and the census are not culturally and linguistically adequate to really be able to track all of the diversity that we have right here in this great city of New Britain. So we really need to be more aware of who's living here and how we can better serve them. And our class standards helps us with that.
That's been a difficulty of the State Department of Public Health always, not getting down to the details of really the smaller populations compared to the larger populations. But that's something that they also are working on, trying to figure out how to do that better. And I think Michelle, there's over 750 families now in New Britain that are Arabic or Muslim. Dr. Abu is Sudanese, and that's the largest population of folks from the Arabic nations that are here now. What we've also been trying to do, and what we intend to do, is to talk more with around that training with Dr. Abu, with the emergency medical services. And these folks really do want to and need to know more about how to speak with people, even in an emergency situation. They need to know how to communicate better with them. Most of these women in that population group are women, and they have certain cultures that, that all of us need to know about. And the emergency medical services have been asking us, to help them with that, to know that, how to ask those questions, when they come upon an emergency situation, how to ask questions better and don't make assumptions, because they're not going to get the feedback that they need in order to be helpful to people in emergency and trauma situations.
They are the fiduciary with the Mayor's Task Force to address the opioid crisis here in New Britain. So we're excited about what's coming together in partnership to be able to serve the community. We have to pay attention to the disenfranchised community also, the pockets of diversity that we have, the grassroots pockets where people are not outreaching into our homeless population. We have partnered with Reverend Dana Smith, who works with New Life 2 Church, and he's developed a integrated faith healing coach training, which really helps people to come together to talk about dealing with trauma in an alternative way. We really have to look at non-traditional resources to get to the people that are not served traditionally by our organizations. So that's been really great in partnering with him and others in dealing and creating that alternative response.
Yeah, I think one of the concerns that I've come across recently is people, again, to get back to the COVID for a second, there are times and places when people can be tested, and everybody at some point really needs to be tested. We shouldn't hesitate with that. But then what do they do after they're tested?
Yes.
Do they stay home? If they're positive, do they stay home, or do they go back to the hospital to say, I've got a headache? And the next day, and they would be there with other people in the emergency room, let's say, and they would be shedding that virus to other people, including staff. So people have to know that when they are when they are tested and if they're positive, that they really need to stay home and communicate with their doctors, or communicate with 211, or if they're really sick, call 911. But to go back into the hospital again it seems to be getting to be a problem. And that's something we really have to be aware of. And the hospitals have to do probably a better job of teaching people when they come in as well.
Marie and I are also involved with the Ministerial Health Fellowship, and they have a COVID response that's funded by FEMA, which is really great to get involved with those folks who are not involved directly with their primary healthcare providers. And that's been really working very well. This is a coalition of 3 ministerial alliances, one from Middletown, one from Hartford, and also from New Britain. And they developed a trusted messenger program, which gets out to those folks that are suffering from COVID, either by loss of job or by contracting the virus or by just losing their way because of their trauma and their emotional reactions.
Michelle, I think one thing we didn't do was to say anything about our own backgrounds. You being a master's in social work, and I'm a registered nurse with a doctorate in education. And I think that's what we bring different aspects of life, actually, life functionings to the table. And so we really, I think our passion has always been to serve others, and particularly those who are medically underserved and socioeconomically deprived. It's so important for people to continuously look at population groups and how people are communicating with each other in a different way or in a more responsible way, because things are, it's a new world out there today, and it's not going to go back to the old world. We're going to have to just keep looking forward. It's the future that we're really attempting to help people understand. And that's a hard lesson to learn.
I'm a community organizer to my heart. So I really like getting out to community people, talking about the resources and making those connections, which is really great. And then to hook up with Marie, who was VP at the Connecticut Hospital Association. Marie, why don't you talk about your work there? Because the diversity teams that developed, I thought was really great.
Right. Well, to go back a little bit to say health equity has always been my passion as well. And I was the first African-American vice president at Hartford Hospital several years ago. And from there, it kind of took off because I worked with the workforce development boards, and then the last piece that I retired from was the Connecticut Hospital Association. What we did there again was working with with all of the hospitals, so at that time 28 hospitals, around health equity and disparities, and the class standards, helping them to know how to use them. It was not the easiest thing to do, but each of them developed and this was really blessed by the CEOs of each of the hospitals. All of the hospitals, each of them created diversity collaborative teams. And within those teams, they had a vice president, or they would have a director, and they had individuals who were responsible for data collection, on which would let us know at the department, at the hospital association, would let us know what their board looked like, how diverse was their board, and what were they doing to increase the diversity of their boards. What were they doing to make sure that they had signage and communication materials for the constituencies that were surrounding and coming into each of those hospitals. But the Hospital Association really is, it is there to help all of the hospitals with this kind of work, as well as, and I think primarily, the financial issues that they face. And it is not, it has never been easy for the hospitals and finances. I'm sure it looks to people in the community that the hospitals have a lot of money to do a lot of things. Well, they have a lot of money, but they're doing a lot of things and they need to do a lot more. And they all know this. So it's, it's just been, great it was great for me to have worked with all of the hospitals around those teams that created their own plans, their own health equity plans with using the class standards, and then making sure that they were holding others accountable. I always tell the story about one of the hospitals up in the northeast corner that would invite people from the community to come in and talk with them about the needs in the community in a very comfortable way. But they also would invite other workers within the hospitals that were not on their teams to come in and talk about how their circumstances when they grew up, what their cultures were, what their food was like, what their environment was like, where did they come from and what language they spoke in the house. So it really enabled the rest of the workers on the team to see those individuals in a different light rather than just the employee piece. So there's a lot of things that, we're really focused on, and it really is all about, the diversity of our environment and just what different people's needs are and what they really feel about themselves. Michelle and I also do a lot of help with self-assessments when we talk with organizations. And the self-assessment, when going back to the implicit bias piece, we also start out with helping organizations that we're teaching with and educating at the time look inside themselves. Because if you don't understand the biases that you have and the microaggressions that you have, you really are not prepared to deal with other people, or you're not, you don't have that enlightenment in yourself, that aha that says, I shouldn't have said this, or maybe I could have said things in a different way. So there's a lot of work that needs to be done. I mean, we do a lot ourselves, but it's nowhere near, it's just the tip of the iceberg of what people really require and need.
So that cultural responsiveness really does begin with you. And I was really excited about the diversity teams that Marie had started in every hospital, and every organization should do that. And that's what Marie and I would really like to do, because the best way to deal with improving in cultural and linguistic competency is to really utilize the diversity within your own organization, which we have found that people are not doing. So we're hoping to help people to do that even more. And we had developed a class learning community right here in Greater New Britain, which was great. So Candace, going back to your question as far as how can other organizations help, Marie and I will begin those meetings again, inviting organizations to come together to talk about this work, what they are doing to enhance the work, what are the challenges, what are the obstacles, sharing strategies and skills with each other, and then getting people to partner possibly in grants or initiatives to really improve the work here in New Britain. And we found in the past that that has happened, and that's been real exciting.
Yeah, and technology is really something these days. So we're on Zoom calls all the time. The COVID hasn't stopped us. We have been on Zoom meetings one right after the other, in most days in the week. And it's Michelle works also out of state in Rhode Island and other places. And so our connection, to other places other than just here in Connecticut is really vast. But I tell you, these Zoom meetings are just incredible. As you know, when we first started this particular meeting with you, little technical difficulties going on.
Always technical problems, but
Yes.
Yeah, but it happens frequently. It really happens frequently. And everybody, I hear a lot of, oh, I'm so sorry. I don't know how that happened, but it happens all the time. So we just have to get used to it. And actually, I feel that we've been able to connect even better with people, because we're able to see you with Zoom and rather than other kinds of technology. with Zoom, we're able to see your, your facial expressions and a little bit of your body language. So we know then how to really talk with you in a different way. But I think it's been good. We were digging our heels in the beginning, and resisting. But now I think we've become a lot more comfortable with this kind of technology, and we can accomplish more and meet with more organizations and more people over a shorter period of time.
Yeah.
So with my heart being in community organizing, I'm going to have to be comfortable with community organizing by Zoom.
That's right.
My. Oh my.
Yeah, for sure.
So a desire that we have is to really be able to reach people of color in a better way around behavioral health. We've been finding that more and more people are suffering from depression, anxiety, bipolar, and with New Britain, which I'm really proud of, claiming that race is a public health crisis. And it is. At least we can look at how we are impacted by current events right now. And looking at Aletha Maybeck, from the vice president from American Medical Association, had talked about how COVID-19 and this trauma has really impacted our immune systems with the lowering of our white blood cell count and the rising of our cortisol counts. I see in New Britain that we are really rising in emergency room admissions. So we really have to look at how we can be able to reach people, talk to people, and help them to get into behavioral health care. There still is so much stigma in the African American population about mental health and mental health help. I mean, it was in my own family. My own father, could not understand how anybody would come to pay me for mental health counseling when all you need to do was to go to the altar and pray, and that would be the answer. And I'm a great believer, I'm a Christian, so we really have to form partnerships in those efforts, and that's where our passion is now, in bringing the churches together and really be able to deliver better integrated behavioral health services.
Mm-hmm. Just to tell you about one of the organizations that we attend on a regular basis that's going on in New Britain is the Greater New Britain Provider Network. And there are, and you may even want to attend that, Candace. There are meetings every other month, and it really is hosted by the Hospital of Central Connecticut. Lynn Feria is the person who it chairs that meeting. But there are providers in provider organizations from around New Britain that attend that meeting on a regular basis, and you can learn from them what's going on. I mean, the communication is just incredibly valuable to everybody that attends. And it's, local community-based organizations that attend, and it isn't just health, it is, social services as well.
Yeah. I find that they're so connected, especially now, health and social.
Mm-hmm.
Everything has to really be connected.
Right.
Well, I definitely share your passion with communication, like getting the community together, because I'm a firm believer in everybody working as a team. I feel like there's just been too much individual stuff going on, and I think that's really hurting our community. So I really love that you guys are doing the work that you're doing. I hope I'll be able to work with you guys more on it.
Absolutely.
Yes.
Absolutely.
Yes.
Especially bringing everyone's faith, like the faith that people have, their beliefs, and intertwining that as well, I think is important, no matter what faith it is, just to, utilize that to help empower people and help them heal is really important. So
what we've been finding also, wraparound is very old, but it's always very appropriate. It is the behavioral health design that's adopted by Connecticut, but it really looks at your spiritual enhancement, however it is. And many people may not be a believer, you may be an atheist, but you still have spirituality. And people being able to express that, to come together for behavioral health and also to connect better with people around those areas is so very important. So I'm hoping people will not feel that they can't join efforts if they're not a believer, but just to really get into their spirituality. I had a friend who had said that her spirituality is really expressed through Tai Chi and yoga. And it is so
Yeah.
very true, to really be able to go within, to meditate, and then be able to reach out and heal.
Yeah. Yeah, yoga is very powerful. Yeah.
Are you involved in yoga? Do you do yoga?
I haven't recently. I do laughter yoga. So,
yeah. Okay.
Nice.
Okay. That's very good.
Yeah.
That participated in that with Advocacy Unlimited
Really
when we were
fun.
looking at alternatives through crisis. And that is one of the natural ways to really be able to have yourself heal. My daughter right now is a minister, and she's at the Tabernacle in Southington, and she started giving holy yoga classes. So ways to worship the Lord through yoga, which I think is so great. She had started doing some of that when she was at De Loretto School here in New Britain, and had a lot of the children to get into yoga classes to be able to come to center themselves, to meditate before beginning school. I think a lot of that is so needed.
Yeah, the kids need that. Yeah,
I think a lot of that is being done in communities all over the country, I think now, and the mindfulness and actually looking inside of your mind and being able to rest and as Michelle said, the cortisol that builds up, like around the waist.
Yes. Oh my.
The cortisol from the stress, and then you're sitting home and eating, right? So we all have those kinds of issues to contend with. But again, there really is a lot going on, and I think I don't know if one thing we may have mentioned was the foster families, and the work now that is being looked at from the behavioral health organizations, but the foster care and the therapeutic care. And we're looking, I think the Department of Children and Families is doing an incredible job with Vanessa Durantes, who is the commissioner, who has really dug into looking at racial justice and health equity, and really helping to I think educate all of the employees. I think there are 3,500 employees in the Department of Children and Families around the state that really are looking at or actually beginning to understand what racial justice is and kinship is within families. And so pulling families together, giving the resources to families who have issues within their families, looking at how do we get the resources to them rather than take the children away and put them, with a foster family. So a lot of that work is going on, and we're having a lot of conversations with those organizations as well.
We're working with Favor, the family organization in Wethersfield, to make those connections. As Marie says, we really love to connect the dots. So connecting that family organization with families that are experiencing this trauma and the need to have their children reunited is really a work that's going to produce a lot of great benefits.
Yeah, Favor has been around, and Michelle knows more than I do about that, but Favor has been around for quite a number of years. And they have some incredible employees who are working with families. And that's the other issue that we have faced, I think everyone has, is reaching out to families and getting them to the table to tell us what their needs are. All of the organizations that we've worked with, and it's, 40 or 50 organizations, but all of them have had issues around how do you get our families, our constituents to the table? How do we get them to participate in these meetings that we have, so that they will really give us the information around their needs, because they know better than, I always say that the community they're the experts. We're not. We do a lot of reading, we do a lot of caretaking, but they know exactly, in a day-to-day situation, they know what their needs are. So that's another piece. And the other last piece that I will just mention is the trauma-informed community work that we are also working on, pulling that all together. Last year, there was a pastor from Pittsburgh who came and talked with members of CCSU and members of the community and faculty and organizations, community-based organizations, about the work that they were doing in Pittsburgh. And I mean, it's absolutely incredible. I was honored to go with Daria Keys, her last name, I think? Yeah, Keys.
Yes.
Daria, right. To Pittsburgh. It was a team of 7 of us that went to Pittsburgh to meet with Father Abernathy and his the people that he had mostly volunteering, particularly around issues of trauma and the community. I mean, he has pulled so many people together in the community to help in this effort. And they're very well organized, very well structured. And he continues his talk and continues to educate people from other states around what he has done. So people take that conceptual framework and mold it to their own communities on how they can improve the issues around trauma and get people to become more interested and more educated in the trauma in their own communities.
Utilize community people also in his work, because he was a big advocate of interdisciplinary teams and working with the formal supports in the community. There's no better helper in anyone's experience than someone who has succeeded from the same experience. So utilizing those people who have been through the trauma that you see, that you're surrounded by, is so very important to be able to utilize. So they were talking about behavioral health specialists to be able to do just that. And when Marie was talking about favor, those families have children that have been in the system, in the child welfare system or another system, suffering from behavioral health. So they are the experts to be able to help other families that are experiencing the same. That's why those connections are really so very important. And that's why we want to create a cadre of these people here in New Britain to be poised and ready to be able to help families when crisis comes. I love when Bruce Baxter, the chief at EMS, had talked about how he and his staff respond to crises. And then they leave the crisis situation and there's no support, and how badly they feel. And what we want to do here in New Britain is, when people respond, we will be able to have people that are ready to give that ongoing sustainable support within the community so that they can feel connected. That is the essence of healing. We need to really look at how we can keep people out of formal supports to be able to help them with healing in their community so that their healing can be sustained.
Right.
Yeah, that's what Father Abernathy was doing and is doing in Pittsburgh. And it is, and people feel so connected to each other when they know that they can count on people when there is an issue, when there is a trauma situation going, when children need to be able to talk about situations that they see, and how do you help kids communicate better rather than just cut off their talk. There's got to be a better way, and there are many better ways for them to be able to communicate, to be able to express what their feelings are. And certainly, Candace, you know this better than we do, but it's so important because they are our future. And if we're not helping and modeling and showing children how to better communicate with each other and how to do their own personal, express their own personal feelings, then we're not doing our job. And we really have to do that a lot better to make sure that they know that they're okay and they are our future, and God loves us all. So, so we're going to talk you to death here, but
the gamut of everything that we've been involved with, what we're able to offer. What Marie and I really like to do is to meet with organizations, to have them talk about themselves, where the gaps are, how we are able to help, so we can really embellish their work in order to fit their own needs.
Is there any plan for you guys to work with schools as well at some point, or is that?
I have been working with school systems around implicit bias. I've been working with a lot of the school systems from out of town. They have contacted the New Britain NEACP, and Ronald Davis, who is the president, will talk about the work that Marie and I are doing and will refer us to school systems. We have gone to the Wilton school system, the Shelton school system, the Burlington school system, and the Southington school system. I am hoping to connect to the school system here in New Britain at some point.
Yeah, I think schools don't really know what they need, and they, and that's the whole issue around cultures, because school is one culture, home is another culture, community is another culture, and we've got a culture right here on this program now. But it's so important that we begin to look at children in a different way, and right now with the hybrid way of educating, and with the the virtual communication that they're doing to teach children, it's very, very difficult for kids to go from one place to another. I have a cousin in New York who is a elementary school teacher. In fact, she teaches kindergarten, first and second grade, and we were talking the other day about the way she is communicating with them online and virtually. And she has just gotten so creative. I mean, she is doing things like, bringing in different kinds of toys, or putting backpacks on her back. And, the communication is just so different. She's having a lot of fun. And the kids are responding that young. They are definitely responding. And then their parents are responding as well. She's very insistent on them being there, being structured, and the timing and all of that, so that they know that they are in school when they are with her. But she just is incredible with the creative things that she is doing. Very innovative with the kids, and that's what they need. And they need to see things. They need to see. It's not just sitting at a desk and doing writing all day long. It's the visualization that's so important for children.
The implicit bias training for the Cooperative Education Services System in Trumbull, and they really liked the implicit bias and cultural humility training and wanted to discuss next steps to that training. So we were thinking about doing something around action research, or the capstone project that students do to be able to get involved in the community and to look at community improvement. So if we could possibly do more of that in the school systems, I think it will operationalize and actualize implicit bias and raise diversity awareness.
Yeah, that participatory research is really incredible. ICR, that's what ICR is all about, and has been there for years and years in partnership with UConn and so many other organizations. I'm on the board of Doncaster in Bloomfield, the planned retirement organization. And what they're thinking right now about doing in order to reach out to communities as a whole, not just the Bloomfield community, but others, is what I wanted to see happen, and I think it's going to happen, is a partnership with universities, whatever university that may be, internal to the state or external to the state, and maybe more. Because I think young people that are in the universities, in colleges now, really need to know how to communicate better with those that have that institutional knowledge in organizations, or just the seniority of people. And so I think that they can have lots of projects to do if there's a good partnership, lots of projects on how you take care of geriatric patients, how you communicate with elderly people in the community, and they could write and publish. I mean, it can be a very good relationship. So there's it just continues to be exciting for me that there's so much going on in this state, and that I'm honored, and we're honored to be a part of some of it.
It's exciting.
So we thank you for this opportunity to be
so
able
much
to
for
talk
coming.
about our services.
Yes. Thank you so much.
I know you guys are so busy, and thank you for making the time.
Right. Yeah. I
We look forward to
apologize for any
following up.
noise. I apologize for the noise outside there.
Oh.
I live in a condo association, and they're doing the lawns out there, so I'm sorry for any noise.
It's okay. Well, thank you so much for coming, and maybe you can come back again another day.
Okay.
Absolutely.
All right.
And
Thank
we will
you so
be coordinating with you.
Thank you.
Yes, thank you so much. Much appreciated, Candace. You take care of yourself and be safe.
You too.
Okay. Bye-bye.
Bye.